Joining us in our newsroom, we have Dr. Paul Christo from Johns Hopkins Medicine. Great to see you.
Thank you. Thanks so much for having me.
So let's jump right into it. We have an epidemic within a pandemic, we would say. What's going on here?
Well, what we've seen, unfortunately, of course, we have the COVID-19 pandemic. What we've seen during this period of time is a huge spike in opioid-related deaths. Now, when I say opioid-related deaths, though, what I mean is synthetic opioids, not prescription opioids. I think there's a big difference there, and an important one to emphasize. Last year, the CDC estimated about over 70,000 drug overdose deaths. So in general, that's how many we had, which was quite high. About half of those were related to synthetic opioids like fentanyl, carfentanil, not prescription opioids though.
And you talk about the opioid epidemic in three phases. Could you explain those three phases?
Sure. What we saw several years ago was an increase in opioid related deaths due to prescription opioids. A lot of that, frankly, though, was not only due to prescription opioids alone, but prescription opioids like oxycodone, for example, hydrocodone, along with other substances like alcohol or benzodiazepines, things like Valium, for example. Over time, that shifted to deaths related to heroin. And then over the last, say, 2 or 3 years, what we're seeing now are an increased number of deaths related to synthetic opioids. These again, like opioids like fentanyl, carfentanil. Now, an example here is fentanyl is about 80 to 100 times more potent than morphine. So you can see how easy it is to cause death.
Mm-hmm. And then you talk about statistics that this actually could be underreported.
Yes, I think it is underreported because so in 2019, we have over 70,000 drug overdose deaths. Half of those we think are related to synthetic opioids. You know, the estimate this year in 2020 due to the pandemic, maybe double that. We just don't know yet. We're waiting.
Mm-hmm. And we're talking about closed borders, how they impact drug supply and make them more challenging to get. Therefore, that price goes up and then the potency. So explain how that works.
Well, due to the pandemic, we've seen a lot of closed borders. I mean, the United States borders have closed, so there's less access to the United States via, train, plane, automobile, if you would. And as a result, there is a lack of supply of these synthetic opioids or other illicit drugs to people who use them. That's increased the price of them. And it's actually also shifted the use of illicit substances to others like methamphetamine. And we've seen actually a lot of deaths, more and more deaths now related to stimulants like methamphetamine, along with synthetic opioids.
Mm-hmm. And then clinicians can advocate. They want to advocate that for their patients' health, there's online support is available, drugs as a treatment is available. How do we get clinicians to convey this message to patients?
I think greater awareness. So first of all, telehealth services are more widely available now than they were before the pandemic started. Telehealth services have been really helpful for those who have the disease of addiction. That might be opioid use disorder, other, substance use disorders, because this links the person to a therapist, to a counselor, to a psychiatrist, and this is key in terms of the recovery process. So I think that if more and more clinicians and people, friends, family members are aware that these telehealth services are available, they'll be much more accessed.
Mm-hmm. And I understand people can access your work. You host a radio show, so tell us about it.
Oh, yes. I host a national radio show on SiriusXM called Aches and Gains, and it focuses on overcoming pain. I mean, about 100 million people in this country alone suffer from chronic pain. So the show focuses on how to get through it by providing compelling stories of those who've overcome pain as well as contributing experts.
Mm-hmm. Wow. So people aren't alone. They need help. It's okay to ask, right?
Absolutely.
Well, thank you for this conversation. I think it's going to help a lot of people, of course, and raised a very important topic that might have been overlooked because of this pandemic, but this is still happening. So Dr. Christo, thank you so much.
My pleasure. Thanks for having me.